Welcome to the Tobacco Online Policy Seminar TOPS. Thank you for joining us today. I'm Danny Lee, a PhD candidate in health behavior research at Keck School of Medicine, University of Southern California. TOPS is organized by Mike Pesco at the University of Missouri, Sun Shan at the Ohio State University, Michael Darden at Johns Hopkins University, James Hartman Boyce at the University of Massachusetts Amherst, and Justin White at Boston University. The seminar will be 1 hour with questions from the moderators and the discussant. The audience may post questions and comments in the Q&A panel, and the moderator will draw from these questions and comments in conversation with the presenter. Please review the guidelines on tobaccopolicy.org for acceptable questions. Please keep the questions professional and related to the research being discussed. Questions that meet the seminar series guidelines will be shared with the presenter afterwards, even if they were not read aloud. Your questions are very much appreciated. This presentation is being video recorded and will be made available along with presentation slides on the TOPS website, tobaccopolicy.org. I will turn the presentation over to today's moderator, Michael Darden at Johns Hopkins University, to introduce our speaker.
Thank you. So today we're going to continue our summer 2026 season with a single paper presentation by Andreas Stoller entitled Impact of Tobacco Advertising Restrictions in Switzerland, a Quasi-Experimental Study on the Effect of Billboard Bans on Smoking. The presentation was selected via a competitive review process by submission through the TOPS website. Andreas Stoller's research assesses the effectiveness of prevention policies such as tobacco taxes, tobacco billboard bans, and regulations on e-cigarettes and heated tobacco products. He's an applied microeconomist using state-of-the-art econometric methods for policy evaluation with an emphasis on causal inference and causal machine learning. He previously worked on Social Security and labor market interventions at the Swiss Federal Statistical Office and the University of Basel. So, Andreas, thank you for presenting us for today.
Hello, thanks a lot for the nice introduction. I will share my screen up. Now you should be all able to see the screen. Please tell me if not, I cannot see you anymore. So thank you all for having me. I really feel honored to present here at the Tobacco Online Policy Seminar. I will proceed to the disclosures slide. So I didn't receive any funding from tobacco or pharmaceutical companies. What I received for funding for this work, and which is also the only funding I received over the past 10 years, is funding from the Swiss Tobacco Prevention Fund, where I analyzed tobacco prevention policies in Switzerland and Europe. I think in this with this audience, I don't have to say it, but tobacco remains a leading preventable risk factor. Despite the declining smoking rates, we have about 8 million deaths worldwide attributed to tobacco. Europe has still the second highest smoking rate worldwide, with about 800,000 deaths. So also in this region, this remains a very important policy question. So this to say, smoking remains a major public health challenge. Of course, tobacco prevention policy is a big topic in health economics. Many papers focus on analyzing tobacco taxation, also the smoking bans in public areas, sales bans for minors, and advertising bans. Then there are a few interventions or prevention techniques that are maybe a bit less studied. The information campaigns or school programs, quit lines, maybe they lack a bit an economic aspect, so they are a bit less represented in the health economics literature. Interestingly, the causal studies, so the studies exploiting a quasi-experimental design, mainly focus on taxation and smoking bans. Maybe there are a few on sales bans, but then the causal evidence for advertising restrictions sadly remains limited, especially for tobacco advertising. I am aware of a few good quasi-experimental studies on e-cigarette advertising or e-cigarette advertising bans. However, for tobacco advertising, I'm not aware of such studies, and except for mine, of course, which fills that gap. If anyone knows about such studies, please tell me about it. I further want to motivate a bit this paper by thinking about why a company would even want to advertise their brand. There is one main argument that is typically put forward by the industry, namely they just advertise to increase their own market share, attracting smokers who already smoke to just smoke their brand instead of another, while the total demand for cigarettes or tobacco products remains the same. So the argument is that consumers would just shift from one brand to the other. However, there is also this market expansion idea that advertising actually persuades people and initiates non-smokers to smoke or increases the consumption among smokers. And it's mainly this second point that I'm interested in. Can one show that advertising increases consumption, or the other way around here, like do advertising bans reduce consumption, and thus would justify regulating tobacco advertising for public health reasons? This is not like an industrial organization paper. It's really about showing the effect of this policy and to see if such regulation is warranted or not. So the main contribution of this paper is that I estimate the effect of cantonal billboard bans. Like cantons are subregions of Switzerland, as you will see in a moment, and their effect on smoking. I provide causal evidence using individual level data, and the findings will support the market expansion hypothesis. So actually showing advertising restrictions can be an important part of a comprehensive tobacco prevention framework. Before I proceed to the data, I want to give you a quick overview on the system that we are analyzing here. It's about Switzerland and policies enacted by subregions of Switzerland. So we have three main levels of government. Namely, we have the Confederation, which is the national level. Then we have 26 subregions, which are called the cantons. And then we have many municipalities at the lowest administrative level, or the villages. Tobacco prevention policies can be enacted at all these different levels, but it's mainly at the national level or then this cantonal level, which also then allows us to use variation in tobacco prevention policies across these cantons, which I will effectively do. The tobacco politics are such that at the national level, we have the tobacco taxes. There is no tobacco tax at the lower level. We have health warnings on the cigarette package at the national level, also TV and radio advertising bans, and a few other like basic regulations. Then at the middle level, at the cantonal level, we have billboard bans, so some form of partial advertising restriction, sales bans for minors, and smoking bans, which were mostly enacted at this cantonal level. And typically it's like some cantons first introducing it, then others learning from them, introducing very similar policies at a later point in time. And eventually, after many years, it might become a national level. So there is some a national policy, so there is some sort of learning going on. And then, of course, we have just interventions that are happening, like information campaigns and other like temporarily constrained interventions by either governmental or non-governmental actors. So just to give you a bit an idea about all the different tobacco prevention policy that can happen in Switzerland. Here we have a map of Switzerland and the introduction of these billboard bans graphically represented. About the billboard ban, I want to say that it concerns only billboards that are in public spaces or that are on private ground but visible from public spaces. So typically what you would see at the side of a street or a highway. So something that you can quite frequently encounter. The very first canton introducing this type of ban was the canton of Basel, a very small Swiss German canton in the 1997. The canton of Geneva introduced it in the year 2000. So these were a bit the very first ones that introduced this type of ban. And then over the years until like mostly between 2005 and 2010, many of the other cantons followed them. So what we have here is really a perfect quasi-experimental design. We have some parts of the population exposed to this type of billboard ban and another part that isn't exposed to this billboard ban. And an important thing to remember here, we don't have much social media yet, and billboards were actually the main advertising channel at that time. So by about 10 times, it was more than all the other media channels that were around at that time. Due to these bans, then the advertisement expenditures reduced heavily for tobacco billboards. And interestingly, there was no substitution towards other channels, or almost no. For newspapers, the advertising expenditures of the industry maybe doubled or tripled, but because the level of newspaper or print media was so low, it hardly substitutes any of the expenditures that were made for tobacco billboards. So much about the policy. Now more about the data that I will exploit in this analysis. I use the Swiss Health Survey data that is given by the Federal Statistical Office. These are cross-sectional waves that are given every 5 years. The interesting part about these cross-sectional waves is that we know of each individual that was surveyed when they started and stopped smoking. So this allows to reconstruct the annual smoking status of all these individuals. So we actually have the smoking history of all these individuals. With this reconstruction of the annual smoking rate, we sadly use some information, namely the time variant information cannot be retained. So we can just track the outcome, namely the smoking status of these individuals, if they smoke or not, their gender and their age. I mean, the age we can just calculate. So with this, we end up with about 1 million observations between the years 93 and 2017. Just to make the reconstructed panel more credible, here I plot once the smoking rate using the original data, where we just have data every 5 years, and once using the reconstructed panel. And what you see is that the smoking rate is about the same in both data sets. So structurally, there doesn't seem to be a big change due to this manipulation. So one may call it recall bias, doesn't seem to impact much the smoking rate on average, like the fact that people might not remember that well when they exactly stopped smoking or started smoking. So I think at this point we will now go to the discussion. So
Thank you, Andreas. That's great. So our discussant today is going to be Christian Science, a postdoctoral associate from Yale University School of Public Health. His research examines substance use, health behaviors, and mortality. So Christian, go on.
Okay. Well, thank you very much. Having read this paper, I thought it was well written. The analysis was thorough and appropriate, and the research question is obviously an interesting one. And as Andreas notes in his paper, a lot of the prior evidence may not be the highest quality in terms of a causal interpretation of how these Billboard bans may impact smoking behaviors. And so I do think that this paper is a unique contribution. I do have a couple of minor points, and this might be putting the cart before the horse. But as it relates to your estimation strategy, so in this country, you mentioned cantons or provinces, and I believe there's only 25 or 26. And so that could potentially be a small cluster problem if we don't have enough geographic clusters, and that might impact our statistical inference. And so could you perhaps preview if that is a concern or not, and how you address the 26 provinces in your empirical strategy?
Should I respond like directly, or do you want to ask all the?
Yeah, you can go one for one. So go
Okay.
ahead. Yeah, sure.
Yeah, thank you for raising this question. And actually, I do not cluster the standard errors at the cantonal level, which might be not that intuitive, because typically in the textbooks one is advised to cluster at the level of treatment, and the level of treatment is the cantons, or the provinces, as you say, and there are only 26 of them. Here I decided to cluster at the individual level because, I mean, from my understanding, clustering isn't about confounding. It's more about the observations not being independent. And when I think about the level of clustering more about independence and not about treatment administration and assignment and confounding, then I would argue that, like, as we have here a panel, the past smoking of the individual, or like just the smoking status of the individual, is the most like dependent part of this whole regression. And that's why, I mean, I cluster at the individual level, and I have about 90,000 individuals where there is no problem with small clusters. Yeah, but I know it's not that, not that popular, but it's just another way of arguing for it.
Yeah, that's a fair point. I do think a worthwhile robustness check could be an alternative type of clustering of standard errors at the canton level, and perhaps using like a wild cluster bootstrap or something, and just showing that your the statistical significance and your inference is unaffected. I think that would be a worthwhile and relatively simple robustness check that could maybe make my comment moot.
Yeah, I agree.
I guess one other question, and again, you can defer this until after you discuss your estimation strategy. So the data we're using, you construct a panel essentially of smoking rates over time. But this is a cross-sectional data, right? And so how do we think about it? Is the data representative? Does it have survey weights where we can weight our analysis in order to make the individuals that we're studying representative of the overall national population or the canton-specific population? I assume that currently you don't use survey weights, or perhaps you do. But if you could clarify what you think the right approach is for that, and that was my only other comment for the moment.
Many thanks for raising the question. And I present often in front of like economics and health science publics, and this seems to be really a health science question. They often apply the weights, while in economics it seems to be a bit something that we do less, or maybe I'm not aware of it. As I mean, here the main point is that I care about internal validity, showing an effect in the sample. But I see the interest of applying weights. I haven't done that yet, and it could be, yeah, maybe it's not even a robustness check, but yeah, it could be an interesting addition to see how, if the effect would have actually be present at the country level of Switzerland. And there are survey weights, but of course they relate to the cross sections. So maybe I would have to calculate weights myself to make the results representative, at least by age and gender. So yeah, it's certainly a very valid addition, yeah, for having a more external validity.
One quick question from the chat. Can you, and maybe you'll get to this, but do you know anything about like the market for billboards themselves? So so the band comes in, these bands come in and change that market in some interesting ways potentially. Can you speak to that at all?
Yes, what I know about it is that it's a quite intransparent market. Like at least for me, it's difficult to find information. I mean, about the industry overall. And with the billboards, there is an association that gives some very aggregated, like general information about about billboards in Switzerland. However, I don't have the funds to ask for this information because it's quite costly, actually. So
I guess another way of saying the question
yeah.
is something like, you know, the billboards that are specific to tobacco products go away. What takes their place?
Yeah, I mean, I think it's a valid question, and I looked into that, but for me it's not feasible. It was not feasible to get a hold of this information. One might speculate, but yeah, here I don't like at the moment. I don't feel, but what could be concerning, for example, one might think that the alcoholic beverages would be advertised instead. Like I thought about such potential limitations, and this could drive effects. I mean, this is like if I would think about the problematic case, then it would be that. However, sadly, I cannot like advocate now in favor or against it because I don't have the information.
Okay, yeah, fair enough. Why don't we move on to the rest of the presentation, and we'll hear about the strategy and the results.
Sure. Okay, now I should be sharing my screen again, and I can just continue with the estimation part. So for estimation, I use a difference in differences approach. Here we with an event study design. So this allows me to estimate dynamic effects on the smoking rate up to 5 years after the Billboard ban introduction. I will also look at heterogeneous effects by gender and age. And an important part that I haven't mentioned yet, but I will not only control for gender and age, but also for other tobacco prevention policies that happened at the cantonal level. So there were these sales bans for minors that were introduced, and also smoking bans in public spaces that were introduced at similar times. It's not completely overlapping with the Billboard bans, but there is certainly some correlation present, as like between 2000 and 2010, cantons decided to introduce a few of these tobacco prevention measures. The way I will analyze the data is using a staggered difference in differences estimator. This estimator is preferred over the two-way fixed effects estimator because we have a staggered introduction of the treatment. So some regions introduce the policy earlier than others, and with two-way fixed effects, we would risk to have negative weights introduced. This is a common problem in economics, so that's why we now use this staggered difference in differences estimator, like here from Callaway and Santana. But there are also others, but this is one of the main estimators one uses for this problem. And of course, it requires common trends and other like standard difference in differences assumptions. And at the end, in the robustness checks, I will talk more about assumptions and how what are limitations and what I could check. I just very briefly want to look at the event study results based on the staggered difference in differences approach, because actually even though the pre-treatment trends look okay, in the event study design, the common trends assumption doesn't hold in this case. So, and this would be required for the validity of this design. But before I talk about this in detail, I will just interpret the results. So what we see is we have an event study design with 6 periods after the treatment. So these are the effects up to 5 years after the introduction of these billboards. And we see here a slight reduction in the smoking rate due to the Billboard bans. The strongest reduction is at the third point estimate, namely about 0.9 percentage points. On average, though, like over all the post-treatment periods, the reduction is about 0.4 percentage points. And the point estimates in blue before the introduction of the Billboard ban are the pre-treatment trends, so they help us to see if the common trend assumption holds. And actually here, it looks like the common trend assumption holds, maybe with 1 or 2 exceptions, but more strictly speaking, it has to hold in all the treatment groups. So all the regions introducing the Billboard ban at a different point in time. For all these regions, the common trends assumption must hold. The pre-treatment trends must be undistinguishable from 0. And if I run that F-test, the common trends assumption doesn't hold. And my interpretation of this is that there is a lot of interventions going on at the regional level that we cannot capture, we cannot control for. There are leaks, there are organizations, NGOs against cancer or for the youth, and there are also like intervention programs organized by the cantons. And we tried to get a hold of this information, but sadly it was not feasible to have a systematic collection of this tobacco prevention going on. So my assumption, or my guess here would be that this unobserved prevention going on that might be heterogeneous across Switzerland leads to common trends not holding. And this is why I use another estimator which wants to overcome this problem, namely the interactive fixed effects counterfactual estimator. I don't want to go into details with that estimator, but you have to think about it like a synthetic control approach. Actually, you want to learn a model that explains the outcome of the treated observations in the post-treatment period if they were not treated. So you really want to model this counterfactual of the treated post-treatment observations. And you do that by training a factor model using all control observations and the pre-treatment treated observations. And in this, using this data, you want to have a model that explains the outcome within this data that should not be affected by treatment. And the twist here is that you don't only do that, but you allow for latent factors. So you model factors, covariates, that are discovered by an algorithm, and which will find patterns that are the same for all the individuals, however differ at an individual level. And for this, I want to show you a graphical illustration of what we are actually trying to discover with this latent factor model. So the assumption is that we have a factor that is the same for all the individuals and that changes over time. However, this factor is more or less present for each of the individuals, also called like the loadings. And this is all hidden. This is all in the error for the model without the latent factors. And this structure is then discovered by this estimator. You cannot really know what it's capturing, but just to give you an intuition about it, we might have a change in smoking sentiments across time. However, these attitudes towards smoking, they might be more changing for some individuals than others. Maybe people who read a lot of media, or reliable media, they might be more impacted by that than people who don't. So this is the main idea of this estimator, that you discover this model of the outcomes so that you then can impute the counterfactual outcome of the post-treatment treated observations. And the treatment effect then is just calculated taking the difference between observed outcome of the treated and the imputed counterfactual outcome. So yeah, I know this method is maybe rather novel in economics. However, now Deschênes Martin and Dotfoy, they discussed this estimator in their new DID book that is, I think, online on a repository for the moment, not yet published. I just recommend you to read that book. It's a really great one with many data applications. And yeah, I'm happy to provide one of the first such applications in economics. The method comes with a drawback, namely that we have many pre-treatment periods that we need to learn this model, and also that this latent factor structure must be like correct and not too complex. I forgot the most important part about this model, namely what it tries to capture. And that's why we have these loadings. So the factors, the intensity of the factors, how the individuals experience it, differs across the individuals, precisely because we want to relax the difference in differences assumption, that the common trends assumption, that so that now we have common trends that just have to hold at the individual level. We can break it down using this latent factor model. So that's the main reason why we want to use this new estimator in order to capture these common trends at the individual level. Okay, so I think I talked enough about this method, and I will just jump to the results based on this latent factor model. And here we see a very different picture. So we still have the pre-treatment trends, which are the differences between observed treated before treatment and the counterfactual based on the latent factor model. And we see that these effects are not distinguishable from zero for the most part, meaning that the latent factor model actually managed to capture quite well the hidden structures that were around. The outcome doesn't always look like this. Sometimes the pre-treatment trends they aren't zero at all, mostly because one has too little information. So one really needs a lot of pre-treatment trends for applying this technique. Then, I mean, the most interesting part for this seminar, we see that now we have a reduction in the smoking rate of about 0.9 percentage points that is immediate and that stays the same. This is about a reduction of 3% in the smoking rate. So this is the main result. I can go over to the heterogeneity analysis, and here we see that and this is the heterogeneity analysis. Also, robustness checks are then all based on the staggered DID estimator. Just to disclose this, here we see that the effect is mostly driven by women, individuals aged 25 to 44 and above 65. The heterogeneous effects are a bit puzzling because one usually would expect an effect among the youth, because the typical argument for these advertising restrictions is that the youth is persuaded or would be persuaded to smoke. But this is precisely not the subpopulation where we find any effects. So how do I explain this? Maybe just other factors are more important for the youth, such as the price or social influences. Or maybe another one, and I think this is a bit unfair to the discussant. I came up with a few other thoughts about interpreting this for today's seminar. Another reason might be that we have substitution from billboards to other advertising channels, even if this is limited because of the expenditure information that we have. There might be still some such effects going on. I don't know if the youth will read newspapers, but maybe this is still a possibility. Yet, something that just comes to my mind right now, maybe another factor might be that advertising targeted to the youth is already banned at the national level. So you are not allowed to have advertising that would be targeted at the youth. However, there I lack a bit the information again on how does advertising actually look like back then, because it's very difficult to get a hold on this information. So this would be my interpretation of why we don't find an effect there among the youth. And I would be really happy to discuss this point, because I think it's very important to know how to interpret now these heterogeneous results and to draw the correct conclusions. And for the second part, why do we find these effects among women, and especially like individuals aged 25 to 44? And there, my interpretation would be that these groups are likely to consider smoking cessation. I mean, if you are usually people stop smoking once they are older. So this would be a bit this age group, and also there are reasons like family planning or pregnancy, which might make this group especially interested in stopping smoking. And the mechanism there, I mean, and this is just speculation, might be that less exposure to tobacco advertising may facilitate the smoking cessation. So we have a population that is more likely to want to stop smoking, and this type of policy might help them to actually stop smoking by less exposure to advertising. Again, here I'm very happy to discuss this point. So I see that I have about 5 minutes left, so I want to lose a few words on the robustness checks and limitations. So as we are looking at this smoking history of the individuals and calculate back their smoking status, I provide a robustness check, just calculating back the smoking status for 5 years, 10 and 15 years, and results are very stable across all these specifications. One can also use, instead of the not yet treated, the never treated units as controls using staggered DID. And again, we have similar results. And using different covariate sets, so none, only individual, and only policy covariates, and a model where all the covariates are interacted, the only sensitivity of the treatment effect is shown once we add the policy controls. An important part are the spillover effects, or the possible spillover effects. Switzerland is really small. You can cross the country within a few hours. So people are very mobile across these cantons. So if you are in a population that is here not considered as exposed to the Billboard ban, you might still commute to a city where there is the ban, and the other way around. So you might have such spillover effects. And I would have assumed an underestimation due to the spillover effects, and now I don't just have to assume it. Actually, like recently, I performed a check for spillovers, adding dummy variable, which is one if a neighboring canton introduced the Billboard ban, and providing this check that again wasn't yet shown to the discussant. Actually, the treatment effect about doubles. So the spillover effects actually really tend to underestimate the treatment effect. And once we adjust for it, the treatment effect about doubled. Then for confounding, I mean, I said already enough about the confounding. Sadly, not all prevention efforts can be tracked, and this is like a major limitation. Maybe in future one can come up with such a systematic collection of prevention. So now I want to wrap up. The evidence here suggests that like both staggered DID and this other latent factor model show consistent results, pointing both to a reduction in smoking rates. The reduction is up to 0.9 percentage points, or 3%. as the share of smoking is about 30%. And this effect is comparable to that one of a 12% increase in, I should have written, tobacco cigarette prices. So the effect is quite substantial. Like it's really, in my point of view, it's a considerable effect. And we have the discussed effect heterogeneities. So finally, we see that there is support of the market expansion hypothesis. So advertising, or let's say advertising bans, they actually can reduce the total demand for smoking. And thus advertising restrictions can be an effective complement to other prevention tools. So yeah, thank you for your attention, and I'm really looking forward to the discussion and further questions by the public.
Thank you so much, Andreas. That was terrific. We will go to our discussant now, Dr. Christian Seitz.
Thank you. Really interesting presentation, Andreas. A few comments and then a question. So I think both in the paper and presentation, it might be helpful to have just an example of a typical tobacco billboard to better understand what drivers and consumers are exposed to. I know in the US, back in the day, a lot of tobacco advertising would have, cowboys, with cigarettes, riding in the sunset. So it'd be interesting to know how the tobacco marketing varies in this country that you study, and have a better understanding of what consumers are exposed to. I thought you addressed the confounding points in a thoughtful way. I mean, you mentioned that you can't control for every possible confounding policy. I do wonder what your thoughts are, though. So let's say that in the absence of other tobacco control policies and public health interventions that you control for, but do you think that your estimates are perhaps an upper bound, and that the tobacco restrictions that they complement these other interventions? And so perhaps in the absence of these other interventions, the policy that you study would have a smaller effect on smoking. Do you have any thoughts on that?
Yeah, thank you for the compliments first. And I mean, I saw a few pictures from back in the times, and I mean, I don't know how it is to live in the US, but it seemed to me like that the billboards are quite similar to what you would expect in the US. I mean, now I don't want to say brand names and so on, but the picture of being like these lifestyle arguments, or these being like back then a strong man, even though that's a bit now an outdated idea, but this was much put forward there back then. Like the type of advertising that I saw from back then in the US and here seems to be fairly similar. And right, yeah, I should show pictures. However, for like copyright reasons, I don't know like how much one is allowed to share. It would be nice to have one, but these can be quite big pictures, like billboards at the wall of buildings. It won't be the Times Square, but this can be quite big billboards that are shown, or just like smaller ones that you see using the sidewalk. Like we use quite a lot the sidewalk. So yeah, especially in the cities. So yeah, that's where you would encounter it. Maybe something that has to be specified here, like it's the public spaces. So Even though I would have never like seen one, but in commercial centers, in shopping centers, like you might be still able to put on these billboards. However, effectively, I'm not sure if it was actually done. And the expenditures for billboards would tell me like that they didn't try to substitute such billboards in shopping centers then with with these billboards. But yeah, again, I don't know enough about these details. I think this is now clear. It's really difficult to have like an accurate idea about how these billboards looked like in these times. Then for the upper bound, I mean, I would rather argue for estimating a lower bound. I mean, one reason is this of the spillover effects, which tend to underestimate the effect. Now I have to think that there were a few reasons why. Now I sadly cannot remember all of them, but there are a few reasons why I think I rather have an underestimation. I mean, especially the spillover effects. It's a shame that I haven't yet put it into the working paper, but once I adjust for spillover effects, then the effect doubles. So it becomes an almost 2 percentage points reduction. So if anything, I think that I underestimate the treatment effect. But I see your point. I mean, having these billboard bans plus then other prevention measures, this might rather overestimate the treatment effect. Given the big treatment effect that I measure, I doubt that it would be as much as as to offset the whole effect.
Okay. And then one other comment was, and I think someone in the chat beat me to this, but do you happen to know if e-cigarettes or other nicotine products were included in this policy that you study? Or,
okay.
or excuse me, or can you also speak to overall trends in e-cigarette use? And is it possible that that this tobacco billboard ban could have been effective at reducing smoking, in part because of the increasing availability of substitute products to cigarettes?
And very good point, and I think it's something that I should make more transparent. In Switzerland, for a long time, e-cigarettes weren't commercially available, like until 2018. So, however, people could import them. So even though it's not commercially available, we see that people like already consume it in the year 2018. Data before on e-cigarette consumption isn't really present. And cantonal legislation on this was only enacted much later, like from 2018 on, because I mean, if it's not commercially available, you cannot regulate it. Another detail that I wanted to add is oh, sorry, I now forgot my train of thought. But e-cigarettes don't seem to like be relevant for this specific application. And the general population, that's it. The general population tends to pick up e-cigarette consumption very slowly. What we see is that rather the youth, like really the school children, adopt e-cigarette consumption pretty quickly. However, among the general population with newer data, you have maybe consumption rates of a few percent. Yeah, that was the point that I forgot.
Thank you.
There are several questions in the chat. I mean, I'll start by just saying, this Safer and Chalupka argument about market expansion, right? You would expect to see that in the youth, right? Because they're the ones who initiate tobacco usage. So tell me if I'm wrong, but what I'm understanding this comment, this mechanism is more like the billboards are preventing cessation, and when the billboards go away, more people are quitting. Is that consistent with your results?
I think that's the argument I want to make, even though it's rather unconventional. So that's why I'm open to like other suggestions that could explain this.
Okay.
Yeah.
Yeah. Well, I mean, I think that has to be it, because it's extremely rare to see someone start using tobacco in middle age. It's almost always at young people, and you find nothing for young people. The factor model is really interesting to me, and it's I think new for TOPS, and so I want to just clarify that I understand it, and maybe clarify for the audience as well. So what you're saying, and so I'm going to try to explain it, and you tell me if I'm right. What you're saying is that there is a latent factor, a single-dimensional factor that is related to the propensity to smoke. It varies across individuals by a factor loading, which you are estimating. But it's a linear term, right? So my relationship to you is in some way, so you and I might be different in our factor loadings in a linear way. Is that correct?
There is some, like, it's all correct on what you said. I mean, exactly. I couldn't have said it better. There is yet another mechanism there. This estimator might also end up using no factor, like no latent factor. There is a procedure there that selects the amount of factors that are included. There can be none, or there can be multiple. And if there are like way too many, then it becomes too complex. And there is like an error between the predicted outcome and the actual outcome that is used as like a target value, and you just use the amount of latent factors that minimizes this like prediction error.
That is coming from the data then. The data
and if you have multiple ones, then if I'm not mistaken, it could be also nonlinear, but here it's still linear. Yeah.
Okay. And then I guess the final thing quickly, you talked about migration. I think you also should probably talk about mortality, right? So in a panel, you're observing the people who don't die from cigarettes, and we know that cigarettes are going to be really causally related to health. And so that might be important. I think you could do an exercise though where you bound how big the migration and mortality effects would have to be to nullify your results. And that would be just a cleaner way of showing us, whether or not these things matter.
You mean like less smokers will end up in the old sample, like in the 65 plus sample, because they just, I mean.
So I mean, on a couple of dimensions, right? So smokers are dying selectively, but also, we know, at least in the US, and I don't know if this is true in Switzerland, but there's been a growing urban-rural gap in smoking that might be differentially exposed to these to billboards. At least in the context of the US, we think of billboards on highways being more of a rural kind of thing, but there's a growing gap there. So over this long period of time, you might have selective migration. that could matter, and you could model that. But we're out of time, so I'm going to kick it back to Danny, who will take us out and advertise the top of the tops, which is coming up next.
Yeah, thank you. We are out of time. However, if you still have burning questions or thoughts for Andreas Stoller, today's presenter, you can join us for Top of the Tops and interactive group discussion. To join, please copy the Zoom meeting room URL posted in the chat and switch rooms with us once this event concludes. And we will leave this seminar room open for an extra minute after the end to give everyone a chance to copy the URL, which is bit.ly/topsmeeting, all lowercase. Thank you to our presenter, moderator, and discussant. Finally, thank you to the audience of 91 people for your participation, and have a top-notch weekend.